Hello and welcome. Today, we're diving into a topic that so many people face, dementia. For millions, a diagnosis can feel like this thick fog just rolls in, making everything from memories to daily life feel confusing. So our goal today is to cut through some of that fog, bring things into focus, and map out what the path forward can look like. Let's jump right in. So here's what we've got on deck. First, we'll get straight on what dementia actually is. Then we'll kind of peek under the hood at the brain's wiring. After that, we'll look at the different stages, talk about what we can do for prevention and treatment, and wrap it all up by looking at how to navigate this whole journey. All right, first things first, what is dementia, really? I mean, we've all had those moments, right? You can't find your keys, a name is on the tip of your tongue, and it's so easy for your mind to jump to the worst-case scenario. Let's talk about the real difference here. Yeah, that's the question that really gets you, isn't it? Is forgetting that name just a sign of a busy day, or is it something more? Well, here's the key thing to remember. The critical difference isn't just the act of forgetting. It's about the impact of that forgetting. The line gets crossed when those memory slips start to really consistently disrupt day-to-day life. So here's a really common mix-up. A lot of people think dementia is one single disease, but it's not. The best way to think about it is like an umbrella. Dementia is the big umbrella, and underneath it are a whole bunch of different conditions. What they all have in common is that they cause progressive damage to the brain, which affects memory, thinking, problem solving. And this is super important. This is not just a normal part of getting older. And getting this right really matters because we are not talking about some rare thing. We're talking about 55 million people globally. That is an enormous number of people and families living with this right now. It just goes to show you how critical it is that we all get a handle on what this is and what the journey involves. So, back to that umbrella idea. Here are some of the main conditions you'll find under it. Alzheimer's is the big one, the one most people have heard of because it's the most common by far. But you've also got others, like vascular dementia, which is tied to things like strokes, and that affects a ton of people too. Okay, so we've got a handle on what dementia is. Now let's go a level deeper and look at what's happening inside the brain. We're going to talk about what's actually causing all these changes. What's going wrong with all that complex wiring up there? Here's a good way to picture it. Think of your brain like a super powerful computer. With dementia, it's almost like the wiring inside that computer starts to get damaged or freed. And when those connections go bad, the whole system has a harder time processing info, saving memories, or even just doing basic tasks. So what's causing that wiring to go bad? Well, there are a couple of big risk factors that are frankly out of our hands. The number one risk factor is just age. The risk really starts to go up after 65. Then there's genetics. If dementia, especially something like Alzheimer's, runs in your family, your risk can be higher. But it's not just about age and genes. There are other ways the brain can get damaged. Things like repeated head injuries, strokes that starve the brain of blood, or even this internal gunk, these toxic proteins that can build up. It really drives home how connected our brain health is to our overall health. Chronic conditions and our lifestyle choices, they play a massive role. Okay, so we know what can cause it, but what does it actually look like as it progresses over time? It's really important to remember that this looks different for every single person, but let's try to map out the general journey. This 7-stage model is a really helpful way to think about it. And it is a gradual thing, right? The first few stages, 1 to 3, are that really early, subtle decline. You go from no issues at all to maybe some mild forgetfulness that you might just brush off as getting older. Then maybe others start to notice something's up. Then you hit stages 4 and 5. That's kind of the middle of the journey where things become more moderate. Daily tasks become a real challenge, and you start needing more help. And finally, stages 6 and 7, that's late-stage dementia. This is where the decline is severe, and people eventually need round-the-clock care and help with pretty much everything. I know. Hearing about that progression, it can feel really overwhelming, maybe even a little hopeless. But this next part, this is where we get to talk about what we can actually do. This is about empowerment. It's about the actions we can take, the support we can find, and focusing on the things we have some control over. And check this out. This is the number that should really stick with you. 40%. Up to 40% of dementia cases might be influenced by lifestyle changes. That is huge. It means we have the power to potentially delay or even prevent a huge number of cases. I mean, that's incredibly hopeful, right? So what does that look like in practice? Honestly, a lot of this stuff is what's good for our bodies anyway. We're talking about 150 minutes of moderate exercise a week, eating well, like a Mediterranean-style diet, and keeping an eye on things like blood pressure. And, of course, keeping your brain busy with puzzles or learning, protecting your head, getting good sleep, and trying to keep stress in check. It's all connected. Now, what about for people who already have a diagnosis? Well, for most types of dementia, we don't have a cure yet. But treatment can absolutely make a world of difference. The whole goal is to manage the symptoms and make life as good as it can be. That can mean medications to help with memory, or different kinds of therapy, like music or art, that help people stay engaged and bring some joy. And of course, having a safe environment and a strong support system for caregivers is just as important. And that brings us to what might be the most important takeaway of all. Getting a dementia diagnosis, it feels like an endpoint, but it isn't. It's the beginning of a new and, yes, a very different kind of journey. It's all about figuring out how to find a path forward, even when that road gets tough. I think this quote just says it all, really. Dementia is like a foggy road. The brain's path is still there, but navigating it becomes harder. The person is still there, the path is still there, it's just surrounded by this fog. The trick is to find new ways to navigate it, together. So, if you take one thing away from all this, let it be this. Our best weapons against that fog are understanding what's going on, taking action as early as possible, and building a rock-solid support system. And that support is for everyone involved, the person with dementia and their caregivers. So I'm going to leave you with a question to chew on. Now that we know all this, what can you do? How can each of us, in our own lives, in our communities and families, help light up that path for someone else who's on this journey? It's something to think about. Thanks so much for joining me.